At KSMO Radio, it's time for our spotlight on the Salem Memorial Hospital. Melissa Carter, our lab director, is in. Yay!
Good morning. Thanks for having me back.
She's all relaxed over here and taking it easy. Well, very good. Thank you for coming by. And I know it's Lab Week. Is it week this week or is it next week?
It is this week. It is
This week.
National Laboratory Professionals Week.
Okay, so talk to us a little bit about that. Laboratory professionals. I mean, this is laboratory stuff has changed a lot over the last 30 years, hasn't it?
It has. So, typically when people hear the lab, they think phlebotomists, right? The people that draw the
Sure.
blood. That's who they see. They don't see the rest of us in the background, So laboratory professionals encompass our pathologists, histotechs, our medical technologists, lab technicians, lab assistants, and of course our phlebotomists. So there's lots of us behind the scenes, while our phlebotomists are the face of the lab.
Sure, sure. And there's a lot of regulations to the lab as well. We know that. Salem Hospital, no secret. Salem Hospital had an incident a year and a half ago, and their lab pretty well got shut down, and it's taken a while to come back. But we were talking beforehand, and everything is looking really good. We've got the new equipment in. You got a new piece of equipment coming in, not quite here. The coag's not quite here yet. Do you know when that's coming in?
They just got the PO, so it takes a minute to get that, shipped in, and they'll come in and help us validate it, so it'll all be
Right.
up to code.
Very good. So tell us what the new piece of machinery adds to our lab.
So as of right now, what we're using to do our coagulation testing is a handheld machine. Okay, that can be in any doctor's office. Anybody can basically use it. So it's not the gold standard. We strive
It's
to
not
have,
even a bronze standard.
Right. It's a point of care instrument, and we strive to have all gold standard instruments. So this particular handheld does not really serve our population well. We cannot perform the test on patients that are on heparin therapy, and
Okay.
we have quite a few
Yes.
of those. So we end up having to send those out to our reference lab. So we're just not getting the turnaround that I would like to see. So with this new instrument, we can establish our heparin therapeutic range. We can test those patients. We can get the doctors the results same day.
So they can actually get the patient feeling a lot better, a
Right.
lot quicker.
Right. They can
without
adjust their medications and whatever they need to do.
Because it really that's kind of hit and miss, isn't it?
Yeah.
For the doctor, they're kind of saying,
Yeah.
"Well, we think you have it about this. We're going to try it. Let's try this, and then if that's not enough, let's try."
Yeah.
Because then it's just kind of experimental.
Yeah, basically.
Instead of having an answer to your problem, well, we know it's this. We just don't know how severe it is.
That's right. They adjust the medication and maybe too much or too little.
Yeah. So since you've been here, we got some new freezers, right?
We did. We got two new freezers.
Now, tell us the importance of that, because the old freezers were kind of like residential freezers.
They
almost.
were, and they were, I kid you not, from the 70s. It was, that particular color that was popular in the 70s.
Avocado green.
That's right. But
And that was a big color back
Right,
then.
right, but-
It actually made a comeback here about 5 years ago.
everything comes back.
Yeah,
Everything
but it
comes
quickly
back.
went right back up.
That's right. That's right. But it was quite old. It's very important for us to maintain a particular temperature for our control materials and some of our reagents, and with the fluctuations that we were having in that freezer, it was detrimental. We really needed to change that out. But we've got two brand new laboratory medical grade freezers, and they have been spot on.
So, Melissa, when you get a medical grade freezer, do these all have glass doors so you can see in there, so you don't have to actually open the freezer and then try and find what you're looking for?
Well, typically the refrigerators are glass. The
Yeah.
freezers are not.
Yeah. Okay.
So you kind of got to
Okay.
get in and get out.
But then you coordinate though in the freezer where
Right.
things are, so you're
That's
not
right.
in there very long,
That's
because
right.
we all know,
The temperature will start.
and especially in Missouri when it gets real hot, everybody opens their freezer to cool off, and then all of a sudden their freezer takes an extra hard time trying to get back to that temperature it needs to be.
That's right. And we have some pretty sophisticated temperature monitoring on it. It's a senso-scientific device, and it actually sends me a text message if the temperature is getting too hot or too cold, and it allows me to react very quickly to mitigate the situation.
So people say, well, why is that so important? Because there are some medications that cannot freeze, and also some that can't get above a certain temperature either, right?
Right. There's a lot of the things that we use that come out of that freezer that once they thaw, their stability time is decreased. So it may be good only for 24 hours or 5 days or a day or whatever. So really we have to keep those really frozen in order for them to work properly.
Yeah, some of the first COVID vaccines are what? Dry ice was keeping it
That's
going.
right.
I mean,
That's right.
is that true?
Yeah, yeah.
They had to be kept at what,
Yeah.
minus 30 or something?
Yeah, most of our stuff is minus 25.
Yeah. So I mean, it's there's reasons for it, so it has long-lasting
That's right.
potential. But at the same time, once it is exposed, it doesn't have a long shelf
Right,
life.
right.
Very good. What? Now you just had another inspection here not too long ago. I think it was about a month and a half ago now.
Something like that.
Okay,
yeah.
so everybody hears about these inspections, and they're all thinking, okay, what's going on? I know, status quo and things of this nature, but they were only in for a few minutes, and they were extremely happy with what they found, right?
This was our reinspection from
Okay.
our last immediate jeopardy.
When you first got here, I think it was the second day you were here that they showed up.
Well, the first week that I was here, the state came in to do a whole hospital inspection. And
Okay.
then it was probably a week and a half later is when CLIA, our agency, came in and just kind of, did their thing. And this was the follow-up to those findings from when they first came in when I first got here. But they were very complimentary. They were very pleased with our progress and told us, keep up the good work.
Very good, very good. And so, let's explain what CLIA actually does. They allow your lab to do what a lab does, because if you aren't following their protocol, their rules, etc., of keeping records, making things accessible, they can virtually shut you down.
They can. CLIA is the representative or the agent for CMS, who's our, the top dog,
Right.
the top governing agency. So if they come in, they set these regulations, not to make our lives miserable, but it's for patient safety.
Sure.
A lot of these things will prevent, medical mistakes or even, let's say a patient fatality. We have to follow these things in order to make sure that the patients are safe. That's the ultimate goal.
Okay, so these inspections they're actually for the benefit of the hospital, the patient, and everybody in the lab too. Because if there's something that you're seeing that's wrong, you guys have to correct it right away.
That's right.
So it's not something. We'll get to that in a couple of weeks, because it can be detrimental, and we don't want anybody getting sick. There's
do
just
not.
no way.
We do.
So the lab volume, I noticed in the last report, has gone up. Okay, so how much capacity can our lab do now with all the new equipment that you're going to get? I mean, you may not know yet with the coag machine yet, but can we double what we're doing now, or would that be pushing it? I mean, I know you're staffing issues. There's always staffing issues, right?
Right. So before I left the lab to come down here, I just did a quick look, and just over a 12-month period, we have either tested ourselves or processed and sent out over 65,000 lab tests. That's a lot for a little bitty lab like we
Yeah.
have. We do send quite a bit out to our reference lab still, but we're in the process right now of validating 4 new tests.
Right.
Ones that we performed prior to the shutdown that we're going to bring back in.
Okay.
So that's going to up our volume. But I think once we offer this coag testing, more doctors are going to feel more comfortable with ordering, that for their patients because they know they're going to get their result right away.
So it's 65,000.
Thousand.
That could go up to 85,000
It could.
easily in a year.
Yeah, and as we continue to grow and as I find more things that we are able to, perform within our laboratory with our capabilities, it'll keep going up. But, change is a slow process, and we're working on it. We want to be the best. We want to be able to offer what our community needs.
So to become a lab technician, what does somebody have to do? Or work in the lab? Maybe not become a lab technician. That might be
Okay.
a little bit pushing it.
Well, to be a phlebotomist, people that draw blood, there's several different ways you can do that. There are certification classes, courses that you can take through local community colleges. That's one way. At Salem, we allow anyone that's a high school graduate that expresses the interest in learning, we give on-the-job training
Wow.
to phlebotomists. Now, we have medical technologists and lab technicians. Now, one of them is an associate's degree in clinical laboratory science, and the other is a bachelor's. Just it differs on what the complexity of what they can do. And that's through it has to be through an accredited college.
Okay. None of these internet courses will work, huh?
Well, some of it's online, but,
Well, man,
there is a
There
required
has to be a
period.
testing process, I'm sure, right?
There's a what we call clinicals. They have to
Sure.
be clinicals, and usually are about 6 weeks. So they would go into a working laboratory and work as a lab tech while they're learning.
Okay.
That's hands-on. That's the way to learn.
Well, pretty.
Because you can
Pretty
get all the theory, online and whatever.
Well, yeah, right. I mean,
But they have to have their hands on. Yeah.
but you have to actually know, see, feel, touch.
Right.
You know, so many people think, well, you can just go online, go watch a YouTube video. Okay, that's not going to show you different things. And if you see something that's not on that YouTube video, what do you do with that?
That's right.
You know,
it takes a med tech a good year or so of working in a nice sized hospital lab to come across all the different things. You know, some populations don't have high cancer rates,
Right.
and you may see one come in, you won't know what to do with that. So it takes a good year to really kind of get your grasp on what you're looking at.
So when you analyze blood and things of that nature, and you see the obviously tick bites are becoming a big thing here. Is there something you actually see in the blood that says yes, that is a tick bite, or is maybe like a cancer cell? You can say what they say. You can see the cells.
Right. Cancer cells,
Separate.
they're called blasts.
Yeah, right.
And we do see
You know,
those.
you can see those.
But a lot of the touch, like you're talking about, you know, Rocky Mountain spotted fever and Lyme disease, and the ones
Sure.
that I'm seeing a lot more here lately, those are actually send out tests, and it's usually a PCR test. It's a more sophisticated test.
Okay. Okay, very good. But we are getting a machine that's going to help with that.
We are.
Yeah, very good. So we have a new person that's going to be coming on in July, you said.
Yes,
Tell us
yes.
a little bit about this person.
Very excited. You know, as I said, our staffing has always been an issue. We have been using travel techs, which are 13-week contracts. You know, they have the option to renew
You
or
say
not.
hi and goodbye, right?
Right,
Yeah.
and so, you know, by the time you get them good and ready, they ready to go. But we have found the same person that found me to come here has located this person, and she was in the military and has traveled just a little bit with travel tech and has decided to settle back down, and I believe they live in Waynesville. And so, you know, she's going to give us a try, and we're going to have her at least for a year,
Okay.
which is fantastic. I'm so excited.
Well, very good. And you say staffing issues. That's not unusual in hospitals right now because all hospitals have staffing
Yeah,
issues,
that's
right?
right. That's right. And I will say that with med techs specifically, a lot of people are choosing to become travel techs because they get paid a lot more. So it's harder for us to be stable when nobody wants to be a full-time permanent tech. Mm-hmm. So that's what we struggle with. But
Yeah.
we're making baby steps to get our lab, you know, fully
Well,
staffed with full-time people.
Right. A lot of times during COVID, I know a lot of RNs and stuff started to become traveling
That's
RNs to try and make more money. But now they're finding nobody's going to hire them at that price
Right.
anymore because they are actually offering them very good incentives
Mm-hmm.
to stay at that hospital now. And you have to go with the flow, I guess, but you better start thinking about making a career change.
That's
If all of a sudden you're used to getting a big paycheck, maybe you're only working 3/4 of a year. I don't know. But if you suddenly find out you're going to have to work 5/4 of a year to make what you did when 3/4 of a year, you may have to go reassess what you're doing.
Yep. Yep.
It's always, and medical field is fluctuating all the time. There's always changes. And I guess my next question is in the lab, we have all these new technological procedures all the time. So how often do you guys have to update your education on the new equipment or new technology?
So as required by our certifying agency, we have to do CEUs, continuing education units. So
Okay.
every year we should be doing 12 units. So that's as easy as going online. There's websites that offer the training. So, you know, it's like a webinar. I want to say, you know, we learn new things, and then we take a test at the end, and we get our credits for it. So we have to earn 12 of those a year. But usually that's the more upcoming things that we don't get to see in our lab, but we can learn about.
Okay. So when they have these medical shows, you hear these conventions and stuff with all the new equipment. Obviously, we're not going to go out and buy the latest and the greatest at Salem Memorial Hospital. We're just not that big. But you have to be aware of what's coming down the pike. So do you guys get literature on that, or do you ask for literature on that, just so you kind of have an idea of what's out there in case something does go down? Because you know you're not going to be able to get exactly the same piece you got.
Oh yeah, I have vendors. They know how to get in touch with me, and they're always sending me, you know, information in the mail about what's new and what's coming, and you know, I keep that in my back pocket.
So there's always not only continuing education of learning new things with the technology, but learning what's coming.
Right.
You know, it's can be mind-boggling, can't it, when you start to
It's-
see
it's
some
a
of these
lot.
things, and then you're trying to keep up with what you're doing on a daily basis, and then knowing that this may be coming in the next maybe 3 to 5 years. Sometimes with technology, it gets here like 3 to 5 months.
Right.
it comes upon you so quickly. So is that part of the reason why there's a higher turnover maybe in labs and things with medical technicians? Because, I mean, it really is hard to keep up on all this.
Well, and you've got a lot of people that, they've been doing this for a while and they get, I hate to say bored, but, a lot of them like to go into research and do, there's different aspects that a medical technologist can work in. And a lot of them like to go to these big reference labs. This is where all the fancy PCR testing and, genetic testing and all the big good stuff is all at these reference labs. And so, that's some people prefer that but that's where it's
just
at.
the everyday ordinary, huh? But then the everyday ordinary has its place too, because, you get a little bit more personal, I think, when you're in a smaller hospital, obviously, because a lot of times, you're not going to see your patient all the time, but you may get to kind of know them just from their lab tests that they're there. I know when I was in the hospital here back with COVID, I think they took blood twice a day.
You're lucky it was only twice a day.
Well, I think it was twice a day. They might have taken it a few more times. I don't know. I was sleeping quite a bit. But, I know in the morning they took it, and they took it again in the afternoon. They're really checking my creatinine level. So because I had a 4.1, and that was not good. And, And so anyway, they were just flooding me with a nice little amount of fluids to try and get my kidneys back on track and get that level down. But that's one of the reasons why blood tests are so important, because it tells you what's going on.
Well, I have a little fact for you.
You have a fact for me?
Okay. I did my homework before I came
Wow.
here, but, according to the interwebs, actually lab tests help with 70% of healthcare decisions. So, like I said last time I was here, without us, the doctors are just guessing. So they base 70% of what they do to you on what we tell them.
Okay. And then a history of those lab tests, too, because like we're talking about, they're taking 2 a day, 3 a day, and all of a sudden they've got my first lab test when I came in on Friday night. They check it again Saturday morning against what's there after I've been on IVs all night long. Then they check it again Saturday afternoon. So they're basing their decisions upon what they see on a continual basis where there's improvement, and there may be something else slipping. Maybe there's too much water, and all of a sudden they're like, uh-oh.
And and our numbers tell them that.
And your numbers tell them that. So it really is, I don't want to say a check, but I can remember years ago, and the hospital hasn't done it in a couple of years, but they used to have 3 times a year, they used to have an opportunity for you to go get your lab testing done for very, very low prices. Okay, I don't know if they ever told you about that.
I've heard about it.
Okay, all right. So I used to go every time, and I would keep all those results. And I would look at them. Where was I 8 years ago? Where was I 10 years ago? Where was I 15 years ago? Where am I now? All those levels you're looking at, and you can kind of see you're pretty low. As long as you're pretty stable all the way through it, you're not doing too bad. All of a sudden you'll see a spike here or there.
Tells a story.
And it tells a story. Something had to happen during that time, and it really is kind of funny because when you talk to your doctor about it, sometimes they say, if there's an issue with it, they'll say we're going to retest you. We're going to take another blood sample because that shouldn't be in there, and there's got to be a reason why it's there. Well, could have just been a flaw. Who knows? Take it again. Let's see what happens. And 95% of the time, or even higher, it really is nothing, and it came out normal, so we're good. But if you don't do that, if you don't take that blood test, if you don't get those exams by your doctor or talk to your doctor about something going wrong, you can't get it early, can you?
No, it's very important that people know that they should have their labs done once a year. Things pop up that you just don't know about. Your doctor may never suspect, but with the basic, labs that they order when you go for your annual, it's going to tell you if you've got a problem with your sugars or,
Right.
if your kidneys are starting to fail. We can tell you all that.
Yeah, gout even. I mean, I always had pretty high uric acid. And then I actually remember one of the nurses calling me and said, how's your gout? I said, I don't have gout. Well, sure you do. You have a 10.1. I said, I don't have gout. I'm sorry. I mean, I don't care what the test says. I don't have it yet. Now, that doesn't mean I'm not going to get it. And that's kind of a warning sign, You need to watch that, but I don't have it. So they kind of assume something because of a high level on the lab test. So, again, it's a good thing for you to know. And I highly recommend that you, when you go to the hospital, get that lab test done. Talk to your doctor about it. Let them say, okay, can you explain this to me? Because they will. They'll be more than happy to explain the blood work they get back. And it's all because of you.
That's right. My team. That's right.
Your team. Well, first off, thank you for coming in. And the special week of Lab Week, we thank you for kind of enlightening on us a lot about different things going on. I know that I saw Donna down there when I came through the other day. Donna used to come in here and do some of these.
Did she?
Oh, my gosh.
I could bet that was interesting.
Oh, my gosh. You never get her out of here.
That I believe.
Yeah.
That I believe. But
She was fun.
she is. But can I just take a moment to give a shout out to my lab team?
You absolutely
Okay,
can.
so-
I'd love to have them.
And I can introduce
Absolutely.
the community to who we have
Sure.
here. So our hospital phlebotomists, the ones you'll see if you come to the hospital and get your lab work done, are Cricket, Ashley, Brenda, and Josie. If you go to the clinic, you'll get to meet Taylor and Kenzie. And the ones in the back, in the scenes, our medical technologists, we have Dina, Caleb, Cheryl, Joe, and Donna.
Very good.
That's
Donna
your
had
Salem
retired. She came back.
She does. She comes
Yeah.
once a week to help us.
Yeah. It's fun. It's a wonderful thing to have. And, of course, and you're down there too.
I'm
Don't
there.
ignore yourself from the team
Thank you.
because it's a great group of people that do a great job.
It is. I'm very, very proud of them, and I very much appreciate them.
Kind of unsung heroes.
That's
You
right.
don't see them. You get your blood drawn. You get to see that person take your blood. You see it go off in the little vials, and you don't see it again. Then you see paperwork come back.
That's right.
And all those people behind the scenes that make it happen, tip your cap to them because they're telling you what's going on with you. Really does a good job.
Awesome.
Well, listen, thank you very much
Well,
for
thank
coming
you
in.
for inviting me again.
Oh, always. The invitation's always open to you. And here at KSMO, we love our spotlight on our Salem Hospital and hope if you have any questions about the hospital, can I give you a call at the lab?
Absolutely.
What's your number there?
Oh, don't get me lying.
How about your extension?
Call the main line and hit the button for lab.
729-6626 or 729-5917. Either one of those will work, right?
You can find the button for lab. Yes.
Or hit one for operator and ask for the lab, right?
Right.
Very good. Donna. I'm Donna.
got Donna on the brain.
Melissa, thank you so much for coming. I got Donna on my mind because after we talked about that. You have a great day,
Thank you
and
very
we will
much.
see you again soon.
All right. Happy lab week.
All right. Thank you.
If you own a small business, you've probably been hearing a lot about the ERC, how it's worth up to $26,000 per employee, how easy it is. You know the spiel. So why am I still talking to you about it now? Because